Hello, my name is Dr. Katherine Lang, and I'm an emergency medicine resident at Good Samaritan Hospital Medical Center on Long Island, New York. Thank you for the opportunity to present my research titled Influence of Emergency Department Daily Volume on Utilization of Computed Tomography Scans. I have no financial disclosures. Numerous studies have shown the use of CT scans in the ED is significantly increasing. In fact, studies are also showing that the number of CT scans ordered is increasing more rapidly than ED volume is. But there are no studies evaluating whether or not the ordering patterns of CT scans on a daily basis is impacted by ED volume. The objective of the study is to evaluate whether the ordering patterns of CT of the abdomen and pelvis and CT of the brain are affected by daily changes in patient volume. One may expect the number of CT scans ordered to increase on low volume days, as there is less pressure to obtain a fast disposition on a patient. However, others may suggest the number of CT scans ordered to decrease on low volume days, as providers can spend more time at the bedside and have more time to fully assess and observe their patient, decreasing the need for ancillary testing. On high volume days, when practitioners have less time to spend at the bedside, they may rely more on ancillary testing and therefore order more CAT scans. Others may argue that practitioners feel more pressure to decongest the busy emergency department on higher volume days and defer CT to an outpatient basis. The study population was across 6 suburban hospitals on Long Island, New York, with a combined annual census of approximately 247,000. The patients included in the study were aged 21 years or older, and the study was across a 3-year period from July 1st, 2015 to June 30th, 2018. In order to perform this chart review was done, and the charts were abstracted from the EMR that is used across these 6 hospital systems. Daily ED volume was calculated for each hospital. To determine high and low volume days, data were recorded into categories based on a cutoff criteria of 1 standard deviation at or above the mean and 1 standard deviation at or below the mean, which can be seen on the table on the following slide. The percent of total patients that received CT brain and CT of the abdomen and pelvis on each high and low volume day was calculated, after which the mean percentage for each volume and hospital was determined using Microsoft Excel, and then we used software in order to compare these results using the independent samples t-test. As mentioned previously, this table displays the high and low volume categories for each hospital. The outcomes of the study are displayed in this table. They varied at each hospital. You can see at Hospital A, more CT scans of the abdomen and pelvis were ordered on low volume days, but there was no difference in ordering patterns of CT of the brain. At Hospital B, there was no difference in ordering patterns of CT of the abdomen and pelvis, and in addition, there were no difference in ordering patterns of CT of the brain. At Hospital C, on high volume days, there were more CT scans of the abdomen and pelvis ordered, and there was no difference for CT scans of the brain. At Hospital D, there was no difference for CT scans of the abdomen and pelvis, and on high volume days, more CT scans of the brain were ordered. There was no difference for either scan at Hospital E, and at Hospital F, there were more CT scans of the abdomen and pelvis ordered on high volume days, and there was no difference for CT scans of the brain. Though the results were not the same across all 6 facilities, it did appear that some hospital ordering patterns changed based on daily ED volume. In addition, it seems like differences in ordering patterns may not only be provider dependent, but also dependent on the hospital. The goal of providers should always be to give equal care to all patients despite ED volume, and by educating providers regarding the findings of this study, it may allow them to be more conscious of the care that they are providing. The sample size of this study was limited to 6 suburban hospitals on Long Island, New York. As a result, the outcomes may not be truly representative of all emergency departments. In addition, pediatric patients were not included. Also, days that were included in the study were not always staffed by the same providers, and variations in CT ordering patterns may have been provider dependent. Finally, the study did not assess other types of commonly ordered CT scans, It only focused on CT scans of the abdomen and pelvis and CT scans of the brain. If other CT scans had been included in the study, it may have produced different results. Thank you for the opportunity to present and for listening.